Well, hello. We're going to present on health and HIV in Mexico.
Say your names.
I'm Reyes.
I'm Hendrix.
And I'm Mireles.
Please. Well, there is a natural instinct to preserve health and well-being, obviously. It's an instinct that has evolved with civilization throughout history. After ages of investigation, experimentation, tragedies and miracles, health treatment has never been more advanced than it is today. While there is a great variety in types of healthcare and systems and organizations to treat health, basically institutions are what define if a nation has a proper healthcare or a response unit. Albeit being a country with violence issues, Mexico has a relatively efficient public healthcare system, which treats those who are most in need. While there could still be improvements, especially in educating about sickness, the system does have a certain response to dangers such as tuberculosis and AIDS. This presentation is focused mainly on the issue of HIV/AIDS in Mexico regarding the healthcare system in the country.
Okay, the healthcare in Mexico. The Secretary of Health attends to public health, while the Mexican Institute of Social Security Service provides health services employees in the private sector. This means then the Institute of Security and Social Services of the state workers cares for the health of state employees. There are 13 institutes in charge of providing high specialty healthcare of the population. There are some. As well as a capacitation and training of specialists to take care of the issue. Most of these were formed around the early middle of the 20th century, that's around 1940. And both AIDS and tuberculosis are very important diseases to Mexico. They're a huge concern. While the AIDS rate is 193 in 100,000 people, the tuberculosis rate is 19 people in 100,000 people. Nevertheless, the principal causes of deaths in Mexico are obesity, which affects 70 million, and heart attacks and lung diseases. The most important health problems in Mexico, diabetes, hypertension, and influenza are also high factors that affect the rates in Mexico. While there are many homicides, most problems are related to health issues. These are the facts. We compared it globally and the ones locally that are in Mexico. They're both taken from the same sources. Just that is translated over there. It's the World Humanitarian Organization. The total population in the world is over there, 7 billion. And in Mexico, 121 million. The AIDS rate is 0.3%, while in Mexico, no, it's 3.3%. And the AIDS population in 2012 in the world was 35 million, while in Mexico is 220,000. This is a huge factor. The under 15 years of age which have AIDS is 3.3 million, and the total AIDS has caused millions of deaths in the world, which is 36 million. Life expectancy of male and female in Mexico is 73 to 78, that's without the AIDS. And the daily contractions of AIDS are 6,300. That means that there are 262 infections per hour. And the contractions since the start of the epidemic has been 75 million, which means it's a huge number that could almost cope with the total population of Mexico. Okay. The last few decades, HIV has been greatly relevant because of its evolution and effects. In 1995, of the almost 25,000 cases registered, cases of AIDS, 30.4% are between 20 and 29 years old. In teens, which is how we are majorly affected, is 10 to 19 years old. The main ways of transmission are sexually transmission, which is the most common, which is less than 50%. It is around 46.4%. And around from the 220 people, 220,000 people that live with AIDS or HIV, 64,500 receive ART, which is a program that is on a soft tissue system movement-based technique, and it is used to treat problems with muscles, tendons, ligaments, fascia, and nerves. And while the number is low in Mexico, and it has dropped significantly in the past decade, there's only a little more than half Mexicans who need ART receive it. The states with most affections of the disease is Mexico City, the Estado de Mexico, Veracruz, and Baja California.
These are the main causes and effects of AIDS. The main causes are unsafe sex leads to HIV and AIDS, for example, by using a condom, improper use of syringes and drugs in general, and the men who have sex with other men, and clients and prostitutes respectively. The main effects of AIDS are millions of deaths for people of all ages, more spending on treatment for those who are infected. That means less money for the government and people in general, and more infections, especially because of lack of consciousness and education or care.
The infection. Today, AIDS is not anymore only homosexual sickness as it was thought before. Right now, all the people can get infected, right? So the people who get more infected are men who have sex with men, the sex workers, the clients of those sex workers, people who do drugs or injected improper infections. UNAIDS says that men who have sex with men equals 57%, and the male sex workers. Drugs infection users and women can get also infected, are also highly have a high potential of getting infected. But Patterson showed in 2006 that HIV prevalences in Tijuana and Ciudad Juárez was 6% among FCUV, which is female sex workers. The causes and effects. This infection is more concentrated in urban areas than in rural areas because of the populations, right? The growth of populations. There's more population in urban areas than in rural. The unequal access to equality care, and the need to train workers in ART, as my partner already showed what was ART. The long distance between truck drivers to go to healthcare or hospitals to attend this sickness. The population mobility is a factor, HIV transmission in Mexico. The cross-border activities has also been a potential matter to grow AIDS because the infection gets expanded all around the country and around the world. Mobile populations are the high risk in heterosexuals. So heterosexuals right now, as we can see, are also getting infected. Here, as it shows, 50% of men have external relations, sexual relations, than with their partners or wives. So their wives can get also infected, and much more people are getting infected. And this is also because of the inability for women to use condoms and some other prevent AIDS?
Well, treatment response. Mexico has a national policy on HIV/AIDS treatment and has made a lot of advances in providing access to advanced response treatment for the infected people. Although the World Health Organization and UNICEF and UNAIDS all report towards towards universal access, that only 76% of HIV-infected Mexicans actually received treatment, or at least received treatment in December of 2006. According to the Mexican government, supposedly all infected people with HIV are being treated and have services. Mexico was also successful in securing the blood supplies for patients early on, and no cases of HIV have been detected recently through this mode of transmission, supposedly. Mexico has also established a national network of HIV mobile ambulatory health care facilities known as Centros Ambulatorios para la Prevención y Atención en SIDA AE2, which is CAPACITs, which are basically a result of collaboration among the government and communities and NGOs, because they provide mobile, comprehensive, community-based attention and treatment free of charge, totally free, to people with HIV. They're basically vans which go to the houses of patients who need treatment. This is the type of solutions that Mexico needs for general health, since Mexico is a very populated country, and almost 30% of the population lives in rural areas. If the government and institutions implement strategies such as this one to treat all the people in the country, there would be more advancement, which could be seen with, for example, the example of the truck drivers. While there could obviously still be a lot of improvement, there has been advancements in development and progression in Mexico regarding AIDS and general health. But the most important and relevant following step in health development is basically educating the population about diseases and how to prevent them and avoid them, and trying to provide help for those who need it most in new, faster, and more efficient ways, such as the capacities or other methods. Any questions?
What would you do to inform people that live in urban areas that don't have any idea of this?
Well, there are a lot of programs for education. Actually, inside Mexico, there are programs specifically for rural areas to teach specifically about certain things. And while these programs exist, it's important to promote them and develop them more, so they actually have a presence and people know them and they actually work more. Yes.
Do you think like the solution of the government of Mexico will help like other countries?
I think it could apply to other countries.
Make a base, right, for give us solution to other countries' problems, because Mexico is not one of the countries that was very big, but it's not also very low. So it can help give a base to other countries to make their
help us a foundation to make
Yeah, it could help as an example, but not all countries are as Mexico, so it could be a foundation for other projects. Yes.
How is the WHO helping Mexico solve this issue?
They have a great support for, I was mentioned tuberculosis, but the WHO basically focuses on as well rural areas, sending supplies and sending volunteers and doctors to rural areas more than something like AIDS. Yes. Yes.
Well, so what about prevention? Would you say that is a much more viable way of dealing with the problem?
Of course.
There's also already sexual education in all the schools in Mexico, public and private schools, that help to prevent the cases. Right now there's more information than was in the past, so less people are getting infected. People know more about the infection. People right now care about the infection, right?
The condoms are being
There's social awareness about the infection.
exactly. Because people are using condoms more, and basically the most important thing is developing education because women can get infected because of their husbands or boyfriends don't want them to use condoms or whatever, and that also leads to domestic abuse. But basically, educating everybody about the disease is an important thing because it's a disease that affects everybody in a terrible way.
How does the Mexican healthcare system place itself at a global scale, like compared to other countries?
Well, as mentioned, all healthcare systems are different, very different actually. The Mexican healthcare system isn't too good, but it could be better. But as was seen, there have been improvement, there has been developments, and especially now Mexico has more doctors than it has ever had before.
I mean, have very good equipment like you go to public hospitals and they have better equipment. Maybe there's better service in private hospitals, but this helps to improve the health of people, right? With better equipment, you can get better health.